Happy
Play Therapy Week!
We're so excited to be here. Good morning. I'm here with Tammi Van Hollander. I'm so happy. She is one of my friends and colleagues, and we're excited to get this week off to a great start. And so comment below anything you're doing to celebrate Play Therapy Week. We would love to hear what you're doing. How long have you been doing the Nurtured Heart approach?
So I got trained in the Nurtured Heart approach about 5 or 6 years ago, and I loved it. And I kept wanting to go for the advanced certification, which was, talk about filling your bucket. I mean, it was just so amazing. I mean, what I love about the Nurtured Heart approach is that it's the same training for teachers, for parents, for clinicians. We're all there together. And it's so amazing. And really, you know, how are we working with challenging children, and how are we even more than filling their buckets? Like the Nurtured Heart approach, it was created by Howard Glasser, and he really just saw like all these behavioral plans just not working. And that's why I got trained in the Nurtured Heart approach. I'm like, if any other teachers or parents ask me to do a sticker chart or a behavioral plan that's gonna fail, like I'm done.
Yeah,
and
you're like, I don't want to.
I couldn't find anything, you know, that was really working with everybody on the same page. And I am telling you, just for me, I mean, Nurtured Heart approach has been such a game changer with my most challenging kids. And it really, although it sounds like this very soft approach, right, to therapy, to counseling, and it's really not. I mean, it's very clear. They often call it like this warrior approach, because there's absolute clarity in it. And it has completely changed me personally and professionally. I mean, my most difficult cases and parents who have gone through every therapist and read every book, and they've just are at their wits' end. And during this time of the pandemic, I've been doing so much Nurtured Heart approach coaching, and to see them light up and to see things working has just been unbelievable. And it's really changed my whole practice and my whole lens of how are we hijacking kids' greatness and what's going right. You know, we often in the play therapy world say we're gonna catch them being good. But in the Nurtured Heart approach, it's like they are good, and recognizing it all the time. I mean, even the child who's having difficulty going to sleep and it's a power struggle, like what are all the things that are right and great about that child? That they have a creative mind, that they're thinking about things, that they have this energy, or they have excitement for something that's going on for tomorrow. So we're taking these moments that can be energized in such negative ways, even to a child who's making a mess. What creativity does making a mess show, right?
A ton,
And
yes.
how are we changing the lens? And it's just shifting the energy. So much energy goes into what's going wrong when kids are doing so much more, you know, right, so much more of the time that's wrong. But it's like those big tantrums, right? Those big behaviors that are often, that's where the energy goes.
And so much.
Yes, and I definitely want to put out there when I'm talking about the Nurtured Heart approach, definitely go to the Children's Success Foundation.com. And Steph, maybe you could put that link underneath to find out a little bit more.
I'll put the link and I'll show it up on the screen. Sure.
Yeah, and I hope to be doing one with Pessy, and I hope to be doing an individual one soon. So I'll keep people notified about that one. But it's just been, it just brings so much more clarity to my practice, along with the play therapy. It's just a perfect mix of the two.
Yeah, and for those who are watching who don't know how to get trained in the Nurtured Heart approach and they have interest, besides going to that foundation, is there anywhere else that they can get trained?
Yeah,
not to be a trainer of it, but to learn the approach?
Yeah, excellent question. So on the Children's Success Foundation website, there is actually, you could find a trainer and see if there is one near you. It also has a Facebook page, the Nurtured Heart Approach, that they can go there as well. But there's many people now who are doing them virtually. And there's 3-hour ones and 6-hour ones, and then a 6-week one. So I'm going to be working on doing one soon. I did one this summer and it was pretty cool. I had people from all over the world to participate, and it was pretty neat. So if you go to the Children's Success Foundation, you should be able to find it. Or if you want more information, you can also go on the Nurtured Heart Approach page and find more info. And it's a lot of parents supporting one another and peer leaders and trainers who are also supporting others on it.
Oh, wonderful. I love that it's growing and that it's so helpful and that just made such a difference for you. If there's maybe like one parenting tip or one tip for therapists that would maybe like include the Nurtured Heart approach in some way, any tip that you want to share or technique?
Right. Well, of course, I have my techniques. I have all of my greatness techniques in terms of that piece. But I think, in terms of with parents, Howard Glasser says that kids read energy like Braille. And this whole idea of energy, right? And energy alignment and kids just feeling it. And we all feel that energy. And just being so aware of our own energy. And for parents, I do so much work in terms of what do they need, right? And that they have to reset and they have to be the thermostat on the thermometer before trying to reset their children or work with their children. So I think that's a really important piece. And, in terms of, I do a ton of greatness activities, which Steph, I have my greatness, my Casey's Greatness Wings book, and that's doing, all through on the back and being able to have that beautiful attachment-based stuff. And I now have my greatness cards and I have my greatness sticks, but like, it's just not only like with Nurtured Heart approach, they say that like saying just, a word. Okay. So like thoughtful, or you're so thoughtful, you're so kind. They call that like junk food. What does it mean? We have to go so much deeper in terms of recognizing children, and kids want to be seen and heard. So we have to give evidence for all the ways that they showed self-control, all the ways they showed kindness. They could have hit, they could have ran out the door, they could have thrown that toy, but they didn't. And when we give evidence to that, that's part of that inner wealth, right?
Yes.
That we're talking about, than just saying, oh, I'm so proud of you. Like, what does that mean? But when we begin to speak that way, kids begin to speak that way. I mean, I have a 21-year-old daughter and an 18-year-old son, and this is how they speak. Like, I listen to how they speak to their friends and how they speak to others, and they speak so in depth with these beautiful appreciations that it's not this junk food. Like, it's so real and it's so authentic, and it's so beautiful. Once you start doing that, it begins to make more sense. It's part of, stuff of all the things that I appreciate you. I appreciate all the work you have done, the commitment you have had to all the play therapy professionals. It reveals to me such a dedication to your work and to your work with children. And it just shows that you have an unwavering desire to bring about play therapy and healing to children all over the world.
Oh, you're so sweet. My heart is smiling and so warm inside. And I could see the difference though, like just in how you're showing me, like for a kid to receive that. And I think it's so important because the way we speak to kids is often how they're going to speak to themselves and their internal voice. So I like how you're saying the Nurtured Heart approach is very specific.
Absolutely. Like the Nurtured Heart approach, we talk about like this portfolio. Kids begin to have a portfolio, right, of who they are, and how are we able to help them develop that portfolio. And Nurtured Heart, I mean, there's so much, and there actually is a free, I believe Nurtured Heart approach does have a free workshop, and they also have Transforming the Difficult Child, and they have is Howard Glasser's book, and there's a whole bookstore of great books there for the Nurtured Heart approach. But another idea also with the Nurtured Heart approach is like it's taking kids' intensity and it's celebrating it. We've been taught that intense kids, we have to squash their intensity. And what I say all the time is that the most intense kids, like if it's nurtured the right way, they're going to be the world changers, right? They are going to do such amazing things. But if we squash it, who knows what direction they're going to go.
Yeah. And then it's authentically them. I love that what you're saying about the nurtured heart approach, because it is celebrating that as opposed to just squashing it.
And as we all are talking about the nurtured heart approach, I also have to give a plug for my play therapy colleague, Dorothy Derapelian. She has, she's a nurtured heart approach trainer, and she has a whole series of books on core attachment therapy, which takes nurtured heart approach and some of those attachment-based activities as well. So she's done a lot with that too. We have a lot of great, Lyla Tyler, a lot of great Shirley Taylor. I have to shout out to all my play therapy colleagues who are also nurtured heart people, because we're all in this together.
Yeah, yes. And I love that the world of play therapy, and what's so beautiful is I think that the play therapists are not only passionate about helping kids, but helping each other help kids. And I think everyone is teaming up, especially during the pandemic and everything. So I have loved all the resources that you made. Like it was like teleplay therapy day one. I'm like, okay. And you're recommending books and resources, and you've been teaming up with so many people. And so I love all that you have brought to it.
Oh, you know what? One other quick thing is It's a Beautiful Day in the Playborhood, the World Edition by Leanna Lowenstein. So I think, is it next week? I think I have to check. It was February 20th and they changed it, but
yes, that's on February 3rd, I think.
Maybe it's February 3rd. So that's another really excited one, and so happy to represent the USA to be able to talk about, greatness activities. So that's another good one. So everybody's doing so many great play therapy things to celebrate Play Therapy Week. It's pretty cool.
I love it. And I wanted to ask you this earlier and I didn't get to, so I wanted to bring it up. Can you share a little bit about kinesthetic storytelling? Because I know that that is what your book does. And so I wanted people who don't understand that maybe to hear just a little bit more so they can understand like what it's purposeful for.
Sure. So I got trained in FirstPlay Kinesthetic Storytelling with Janet+Courtney, who is amazing. So really, I mean, basically with the kinesthetic storytelling that I was trained in with Dr. Courtney is really how are telling different stories and being able to tell the stories on the child's back. In this world, touch is often so taboo, but how do we make touch positive? And we know that negative touch, right? Those cortisol levels go way up. But when we have positive, nurturing touch, it's that oxytocin, that loving and joy hormone that goes up. And when we give that positive touch simultaneously, ourselves and that other person simultaneously, that the cortisol, the stress hormone is going down and the oxytocin is going up. And it's such a beautiful way to be able to regulate them. And so Janet has her book, The Rainbow Hug, and there's a couple other people who have done some books. I don't want to speak of because I can't remember everybody's name.
Yes, but I think Carmen did one.
I thought Carmen did one. I wanted to check on that. And so for my book, it's all on greatness. So every time there's a greatness word, we do a heart on their back and installing it. It's almost like that EMDR of how we're going back and forth and installing, but just being able to ground them and to have that appropriate touch. And I do all the time now, especially with TheraPlay, and do so much with attachment of kids doing different backstories, or, I don't know if you're trained in TheraPlay, but like the weather report and doing the weather on the child's back. But the more that we could do this beautiful work where the parent is being able to celebrate and be able to do this appropriate touch, it's such a way of connection and helping them to regulate. So definitely also just put all Janet's stuff on. Her training was wonderful. And part of it is her infant, the kinesthetic with infants and working with infants, and it's the baby tree hug. And the baby is part of the tree. And as we do it, it's regulating them, down-regulating them, up-regulating them in this beautiful way to be connecting with babies. And especially whether there's been trauma or preemies or moms who've had postpartum. I've had parents come to me whose kids are on the autistic spectrum and they're concerned about their babies. So doing this stuff early of that great attachment work is just beautiful. So, and it can all be done now online because the clinician never touches the baby. The practitioner, it's always we're just training the parent to do it. And we have our own baby dolls that we're showing them how to do it with.
Oh yeah, you can.
And I went into that because I was doing all this attachment work and recognizing that it was trauma from birth on. And I was seeing kids at 3 or 4. And I'm like, why not start working with little ones and babies and get them as early as possible of that developing brain to be able to build these healthy brains and these beautiful attachments.
I love it. Yes. Why not catch them? I think the younger, the better, that they can start getting that extra support. And then also the parents, right? The parents get to be included at such a young stage and feel like they are doing something, and then getting them involved and helping the attachment between parent or caregiver and the baby.
Yeah, exactly. Because especially if you have a parent who, if there's a preemie or that's so small and the baby's been in the hospital for so long, they come home and they're terrified to touch their baby. And that touch piece is so important. So that's what's so beautiful about this method of how can we safely touch them and how important it is to touch them. But there's so much anxiety when they, with the touch when they're so little and so frail. So it's really beautiful. I'm so grateful to Janet+Courtney's work.
I know. I'm so excited. Who's just another, wonderful therapist here in Play Therapy Week. I go,
so many.
So many. I know. We could talk about them all day. I go, oh, but it's such important work. Yes. And I love it that her work is influencing the work of so many other therapists and touching the hearts and lives of so many little ones. And so it's just so beautiful.
Yeah, it is.
It is. Yeah. What are your plans for the week?
I'm so excited for Play Therapy Week. So I did my own video. Beth Richey and I just did a recording for a free downloadable whole PowerPoint for telehealth, which we did one in April, which I use all the time. And Beth has been so wonderful in providing free resources. So we just did another one that's going to be released for Play Therapy Week. And I'm excited that my tele-play therapy blog that I did in March is now going to be featured with Pessy, and they're actually going to be celebrating Play Therapy Week with my blog and all of my teleplay therapy videos that I did from the very beginning of the pandemic. So I'm like most excited by this, that play therapy is being recognized and it's being celebrated. And Pessy is one of the biggest continuing education, programs in the country. So just anything I feel like that we can do, and Steph, you've been doing such awesome stuff to celebrate play therapy. So that has been, so I've been doing that, and I'm we just finished the World Association for Sand Therapy Professional Conference, which was beyond believable. And right from there, I did my 5-day Nurtured Heart Approach certification to become an advanced Nurtured Heart Approach trainer. So I'm like, busy. My bucket is feeling very filled with all of the stuff that I am passionate about. And so life is busy, but good.
I love it. And I know we're, getting close to running out of time, but is there anything else you want to share or any other message that you want to share with everybody for Play Therapy Week?
I mean, I'm just doing lots of resources. I think we're all creating resources and trainings, and whether you're going on to the Association for Play Therapy or whatever you need to do. I have some things on my website and my Play Therapy page and my Instagram page. I mean, those of us in the play therapy world, we're passionate about it because we know it works. And we see it work. And even through a pandemic, it works, and it's, my schedule's completely full, and I have a long waiting list, and even at little ones that nothing's going to take play therapy away, and not even a pandemic can stop us from doing our work and doing it well.
Absolutely. I think that's a perfect ending message, that like play therapy is going to keep on going. Like it's going to keep on helping kids heal, keep helping the kid and the family.
Yeah.
And coronavirus, any pandemic's not going to stop it. We're like, no,
Nope.
we're just adapted. You know, everyone's just like, we're just going to adapt it and try to make it the best we can. And all these new terms came out. And I think that's just a wonderful message that like healing will continue through play therapy.
It will, and we will be back in the playroom.
That's right.
We all the things that we know, that we will be back in the playroom, and that we could do both, which is pretty cool now.
That's so awesome too. And especially for kids who maybe can't come to the playroom at a certain given time. So I go, yeah, we're going to keep on playing.
Right now I'm looking out the window right here, and we're in the midst of a big snowstorm. So today, if I was having clients, I would be able to see them on telehealth, even if I was seeing them, that I could switch because there's a big snowstorm. So
I love that.
Do it. Changing our lens.
That's right, we are. Well, thank you so much for joining me and chatting with me. I will make sure to include all kinds of links so me and Tammy will get them to you. Thank everyone, and happy Play Therapy Week.
Happy Play Therapy Week, everyone.